Earlier this week, the House voted to repeal the National Health Care Reform Law. A new study shows most voters agree with what they're doing. A Rasmussen Reports telephone survey of likely voters found 55% favor repeal, 40% oppose it. According to the study's author, the bottom line here is controlling the cost of health care.
If you ask about straight up repeal, most say they'd like it. But the truth is people are looking for health care reform. They're looking for something that will make the situation better. And the biggest thing they're looking for is something that will begin to get the cost of health care under control.
And by contrast, another survey, this one conducted by the Associated Press, GFK, found only 25% of people polled say they support repealing the health care law. And that was down from 46% in favor of repeal earlier in the month. The impact on small business seems complicated and debatable. And here to take a look at some of the pros and cons is Gene Marks, management columnist for the New York Times and Forbes magazine. Thanks for coming in, Gene.
Hey, Joyce, good to see you again.
Good to see you. It's quite a numbers game when it comes to which small businesses are affected and how, right?
Yeah, it really is. I mean, first of all, let's be clear. All small businesses are affected by the health care law as it stands right now. I mean, if you've got less than 25 employees, you're eligible for a tax credit. So, you know, if you have less than 10 employees, you can get a 35% tax credit, and a little bit more than 10 employees, you can get a little bit less than that 35% tax credit. But less than 25 employees, you get a tax credit. Even if you have more than 25 employees, all small businesses are affected because of some of the reporting requirements that come along with the law itself. So there's reporting requirements for your 1099s that you issue to subcontractors, and there's reporting requirements for your W-2s as well. So
kind of complicated.
Yeah, you should ask your accountant about that stuff.
Okay, so are these points of the law already in effect for small business, or do they go in effect later?
Yeah, some of them are, and some of them are coming up. So the ones that are in effect right now are the tax credit stuff. So if you're eligible, you are eligible for that now for last year's taxes and this year. So definitely ask your accountant. Now, when I mentioned about that 1099 rule, again, that form that you send out to your contractors that you're dealing with, that comes into effect next year, 2012. And the same thing when you're reporting on your W-2s for health employment benefits, that also comes into effect in 2012. But you got to start getting ready for that stuff now, because there's some data that you're going to have to be filing in 2012. So again, ask your accountant about that. Ask your health benefits administrator. If you're running a small business, you know, this law is starting to take effect. You got to respond.
Good advice. Republicans call the current law a job killer. How true is that?
You know, it's really tough to see where the Republicans are coming from, and I can't really speak for the insurance industry. I can only speak as a business owner, and I can only speak about my clients and the people that I write and talk about and my audience. And as business owners, I don't really see it stopping us from hiring people. I mean, healthcare reform legislation has been a long time in coming. Well, many of us are already providing healthcare benefits to our employees anyway. So, you know, I don't see, and I don't talk to clients that are saying to me, gee, we're going to be hiring less people because of healthcare reform. If anything, a lot of the stuff that's going on in Washington now is just creating a little bit of uncertainty for us. So we don't know what the overall costs are going to be.
And on the other side of that, the Democrats are claiming that 130 million Americans under 65 who have pre-existing conditions could lose all coverage. How true is that?
You know, first of all, I don't know if the numbers are true or not, but I can tell you this much. Because of this new rule with pre-existing conditions, it basically means as a business owner, I can finally hire somebody who has a pre-existing condition that really a year ago, they couldn't have left their job in their old health plan because that pre-existing condition wouldn't have been covered. So the fact that that rule is now in place now, it kind of frees up some smart people to go out on the job market, and it helps me as a business owner kind of find some people to hire.
Now, the newest thing that we're hearing is that a measure is going to be introduced next week, maybe Thursday, I'm hearing, to instruct House committees to draft a replacement health care bill. Is that likely to happen, or is it more symbolism? What is going on here?
Joyce, I wish these guys would spend more time coming up with a cure for baldness than going back and forth with all of these different measures to repeal, because I don't think it's ever going to happen. You know, right now, you know, the Senate is controlled by the Democrats, the House is controlled by the Republicans. We have a Democratic president. He's going to veto any kind of repeal or any kind of new significant change to the Health Care Act. So we're telling our clients, I'm telling my readers, look, the law is the way it is right now, and unless something big happens, and keep an eye on it, you got to move forward on what the facts are now. And the facts are, health care reform is really, you know, it's reality.
All right. Gene Marks, thanks so much for coming in tonight. Good to see you.
Thanks, Joyce. Great seeing you.
Take care.
It's reality.